So you actually ran a really important study that opened our eyes to how we perform intervention. It's called the DEFINE PCI study. And in that study, you talked about missing lesions. And I would say as interventionists, we're looking at the angiogram, we're very focused on looking at disease that we can see. And yet your study showed something slightly different. Can you talk me through that?
Yeah, so DEFINE PCI was actually a study looking predominantly at the PCI results.
Yeah.
So we looked at lesions that were significant physiologically as an entry point, but then the idea was to do PCI as of standard of care. Mm-hmm. Basically, based on the angiogram, imaging was allowed if the operator so chose, right? And then what we said, when the operator thought they had a good result, they basically were done with the case. We asked them to do a blinded IFR assessment and IFR pullback.
Right.
So we can determine what is the rate of residual ischemia in those cases where you thought you did a good job.
Okay.
And then more importantly, define where it's coming from. Right. Is it that the stent wasn't optimized that was placed? Is it that they missed a lesion? Is it that there's diffuse disease and the stent's not going to make a difference? And so what we found was that in a quarter of cases, 24%, IFR was still at this ischemic level of 0.89 or less.
Right.
So that's higher than I thought it would be, first of all. Yeah. And then what we found is that the vast majority of cases where this happened, 80%, actually were missed focal lesions.
Wow.
So diffuse disease was predominant in 20%, which is not a small number.
Yeah.
But in 80%, potentially, the PCI result could have been optimized with that information.
So this is absolutely fascinating. So an interventionalist has recruited a patient into the study, they performed the angioplasty to the best of their ability, achieved what they feel is an optimal result, and yet in a quarter of the patients, the vessel was still ischemic.
Right.
And in 80% of those cases, there was still focal disease that had been missed.
Correct.
So this means that perhaps we're not understanding the angiogram very well, even though these are expert operators, and this is showing us that the physiology is demonstrating something that we hadn't appreciated or seen.
Well, I think there's a couple other lessons here, right? The first lesson is that this is not even average angioplasty.
Yeah.
This is better than average angioplasty because remember, everybody had a physiology assessment in the beginning.
Right.
Which is also, not, I mean, how often does it happen?
Yeah.
10 to 20% on average in the US or in the UK. So this was 100% physiology guided, if you will. So only those lesions were in fact addressed that were significant by physiology.
Okay.
And even in those cases, we only have, 75% success, if you will. 25% still have significant ischemia.
Right.
So that's a pretty interesting finding.
Well, it's an eye-opening finding, isn't it? Because it really shows us that we've got to up our game if we're going to be able to help our patients.
Well, it also shows that we need to transform how we use physiology, right? Because it's not a spot measurement. It's what we discussed before, using that pullback to identify how to best treat the vessel.
That's really eye-opening stuff, and I think it's something that we should all be integrating into our practice.